Good afternoon. Welcome. Thank you all for being here on a partially rain-out day, but it certainly is nice to see fall weather. This beautiful weather we've had kind of sporadically over the past couple of weeks. I don't know about you guys, this is one of my favorite times of the year, particularly in Galveston. The air dries out a little bit. We still see the tourists, but a lower volume than we do. Of course, we had the bike rally this weekend. That's always a fascinating experience. It was a very nice time of the year. And thank you all for coming out today. What I wanted to do today is just kind of review what FY17 was, how we did, some of the things that we accomplished, sort of our overall assessment, and how it sets us up for moving forward. And of course, that then leads into, well, where are we going? What are our priorities for this current fiscal year? And how do those fit into our plan? So we'll spend just a little time talking about that towards the end of the presentation. Of course, I always like to start off with the recognition and the Way to Go awards. And we have three worthy groups of recipients today. Let me start with these guys, Lonnie Winston and Seth Grimes. Are you guys here? Come on up. There they are. All right. And of course, you remember what this award is really about. It's an opportunity for me to recognize people who do what just about everybody does here every day, which is go beyond the normal to do something that's significant for a patient or a fellow employee or a visitor. And these two have done exactly that. Thank you guys for coming up. You're not embarrassed to be up here with me, are you?
Of course not.
Thank you. What they did, and some of you probably remember this story, back in mid-August, there was a young high school football player in one of our surrounding communities who collapsed on the field and was life-flighted here in very critical condition. And the word spread around. It was covered by the major news agencies. And one of the things that happened, the J.J. Watt Foundation found out about this and arranged with the Houston Texans for this young man and his family to get a very special package from them. Well, it came to UTMB. They knew that the young man was hospitalized here. But unfortunately, because of the way this happened, it had a family member's name on it, not the patient's. Well, that's a problem for us because we don't have a delivery service. We can't track down somebody who's not actually in the hospital. But these guys were involved in coming up with the solution. We worked through the mailroom. We found the package. These two came in on a Saturday, on a day off, and went through the materials management warehouse, through all the packages that we had there, and found that package for that young man and made sure that it got to him and his family. So pretty incredible, above and beyond effort. Thank you so much. So we have these shirts for you guys. Lonnie, this is for you. Seth, this is for you. Nobody else has blue shirts like this, at least that we know of, and a little pin that you can wear. So I know you have to wear a uniform most of the time, but hopefully there's a time when you can wear those blue shirts. And we're very proud of what you do every day, and certainly what you did on this particular occasion. So thank you very much. I really appreciate it. Can we get a picture? Would that be okay? All right. Thank you, guys.
Thank you.
Okay, next, for those of you in the healthcare system, you may know these three. They're not quite notorious, but perhaps they could be or should be. Dr. Lowe, one of our internists, is one of our physician advisors for the health system. The physician advisors are engaged in working with the care management staff, our physician staff, the nurses, to help us make sure that we're doing the right things for patients, we're getting things together, we're managing our inpatient census, doing the things that we need to do to customize care for the individual patient's needs, make sure they leave here with the things they need, and keep things moving so that we can serve all our patients in the most appropriate way. And of course, our care management staff really drives that. They make these things happen. They work with the physician staff to ensure that everything occurs at the right time in the proper sequence to help get our patients to the course of an inpatient stay and then ready to move on to outpatient care. Well, these three do this all the time. But of course, think about what they were confronted with as we all realized that Hurricane Harvey was coming our way. Of course, we were worried about how many patients do we have in the hospital? Do they all need to be here? What are the special needs? How many of them can we move to a place of safety? How many do we need to keep? What staff do we need? Those sorts of things. They didn't worry about how much time it took, what was involved. They organized, they worked through those lists of things, help us get our inpatient census down to an appropriate level so that our staff could take care of those patients with the appropriate resources available, particularly when we were shut off from the rest of the world for a few days. So I just wanted to call them out and say thank you for really great work, for setting a fine example for how we respond to whatever comes along that stands up as a threat to our staff and our patients. These three, I think, just did an amazing job. So Dr. Leah Lowe, Rebecca Castro, Beth Castellanos, would you guys come up? Thank you. I know you're not embarrassed, right? Thank you very much. Rebecca, thank you. Okay, there's one for you. Rebecca, there's you. Dr. Lowe, thank you. Yeah, you get a photo? Sure. Thank you. Finally, Tia Janes. Tia, are you here? Come on up. So Tia is one of our pediatric social workers, and again, like Rebecca, other members of the care management staff, they have tremendous challenges they take on behalf of our patients and their challenges. And Tia is probably, to me, one of the most challenging parts of your job is working with families when they lose a loved one, and particularly a child. And in this particular case, for which you were recognized by coworkers, a young family had lost a young child. They didn't have any resources. They were totally lost, obviously very bereaved. And you reached out to them, went above and beyond to not only help them deal with that loss, but also even secure resources so that they could bury their son. It brings tears to my eyes. So anyway, great work. Thank you so much. That's exactly what we want to see every day in support of our patients. So thank you so much. Thank you.
I appreciate it so much.
Thank you. Thank you very much. So, I think I've said before, I think everybody here probably deserves a blue shirt for the great work that everybody does. But I appreciate you all sending me information about events like these that we've recognized today. Please keep that information, those suggestions and recommendations coming in. We want to do everything we can to recognize the tremendous work that all of you do and all of our people do every day. So thank you for being supportive of this program. I'd like to move on now and talk about our SECC effort. This has been kind of a tough year with a lot of things happening, and particularly with the passage of Harvey. We have a lot of our own folks in need, still in need, and I know a number of you all either here today or out there in the audience are helping a loved one or a friend, perhaps providing a roof over their heads or providing transportation or other support as they try to recover from the significant flooding or other storm damage that's impacted their lives in a negative way. But we still have this desire, and certainly a need in our community, to support the ongoing efforts of a number of other charitable organizations. And that's what the SECC is all about. It really, for those of you who aren't familiar with this, it's essentially a United Way affiliated effort for state employees, thus SECC, State Employee Charitable Campaign. And what it does is gather a number of different charitable organizations, descriptions of what they do, provides all sorts of information about their efforts, their overhead costs, those sorts of things. One of the greatest things it does for me is to give me a listing of local organizations. So Ronald McDonald House, several different food banks in the greater Galveston area, the Boy Scouts and Girl Scouts, our own Good Neighbor program, which does an amazing job to help some of our patients who have incredible needs for equipment and supplies and things like blankets and clothes. We have an opportunity through the SECC campaign to provide a little support for those sorts of charitable efforts in our own local community or communities. And so I know a number of you have already made a contribution. Thank you very much for extending UTMB's efforts to the SECC to help those who are less fortunate in our communities or help programs that are vital to the development of our young people and the support of adults in need. If you haven't already done so, we've extended the deadline. I think the deadline goes through this Friday. Steve Campbell is our sponsor this year, so thank you, Steve, for leading this effort this year. And I encourage you to think about this if you have a capacity and an interest. It all goes for good causes. We're almost to our goal. We set a goal of $550,000 this year, and we're within now under 10%, within 8%, I think. So we're around $500,000. So anyway, please consider this, and if you can, help if you think it's appropriate. All right, so one of the fun things that I get to do is go around and meet with different groups across UTMB and spend time here on the Galveston campus, in Angleton, up in League City, in our clinics, even out in some of the prison units. When Dr. Ojo lets me go, I like to go. One of the interesting experiences I had, Ojo, I went through the metal detector. And I mean, you can't have anything in your pockets. I think I had a gum wrapper in a pocket, and I had to take it out because it's so sensitive. But I learned a lot with these visits. And one of the things that I've heard regularly is our people, no matter where they are, CMC, inpatient operations, institutional support, academic enterprise, want to know on a regular basis how we're doing financially. And that's understandable. I just have always been worried that it's kind of boring information and people might not think it's that important. It might not be as important as other things, but people want to know. So I'm going to, on an ongoing basis as we do town halls, try to just provide a quick snapshot. Our finance people are coaching me, trying to help me present this in a simple way that looks at bottom line performance and talks about some of the issues. I'd like to also encourage those of you who are department chairs, managers, supervisors, vice presidents, to try to do the same at your level. Again, based on this feedback, people want to know. They want to understand. They want to understand what's happening around them, what the financial results are, what the budgets look like, how we're doing. It doesn't take long, so please help me share that information and drive it down to the local level, if you will. But bottom line, we had a very successful year in 2017. So this is a format we've been using now over the course of the past few months. This is our result from FY16. He says it's actual, so actual outcome. It looks at the health system bottom line, academic enterprise, institutional support, our contribution margin, and other significant events, so like what we spend for Ike recovery, Harvey, those sorts of things that are sort of outside our typical budget planning process. And that gets us to an adjusted margin. So you see, we were about 14.1 million bottom line for 16, and for 17, you've probably already seen this information, but we were 14.6. That's good. Okay, now our budget's pretty big, a lot of zeros behind the numbers, adds up to quite a bit because we're pretty big in size and have a lot of things going on. So we're about 2.2 billion in total budget every year. And this is our bottom line, which is a small fractional percentage. Now, if you compare us to other places like us, you'll see places that have a more significant bottom line. That can mean several things. Most commonly, when you're comparing organizations like ours to each other, you really need to look at their clinical enterprise because that's the principal source of revenue. And reimbursement, payer mix, all those things come into play, driving an institutional bottom line. In our case, we have a payer mix that it consists of a lot of public contribution, Medicare and Medicaid, some indigent care figured into that too, unsponsored care. And so that, if you will, limits our upside. So what we try to do is we roughly try to break even every year. You think about the zeros behind 14.6 million and 2.2 billion, there's a significant difference in the number of zeros, right? So, but we want to be in that kind of 0 to 10 to $20 million range, which puts us at that 1 to 2% margin, maybe a little above that. What that means to me, what we're aiming for, is that we're taking the money that's coming in as revenue and we're reinvesting it in pursuit of accomplishing our mission goals. It's okay to break even. There are other elements in terms of our financial management systems that allow us cash, if you will, beyond what we generate with a bottom line margin to use for investment in facilities and equipment and programmatic growth. So to me, again, this is a good result based on who we are and how we work. And as we go forward, this is a sort of result that we will aim to achieve. I'll talk more about that with the next slide. The rest of the information here is just looking at variances, so where we're favorable and unfavorable. And as you all know from managing your own budgets, as we go through the course of the year, we're dead on with many aspects of our forecast, what we expect to happen. But then also, things arise that we didn't anticipate, and we couldn't have anticipated, but we still have to manage them. And so principally, those are the things that drive variances. And our job as managers, if you will, or overseers, department chairs, is to try to make sure that at the end of the year, we still come out in the right place. So we have to, if you will, juggle as we go forward to balance revenues and expenses, and spend a great deal of our time doing that. We've done a really good job over the course of the past several years in terms of hitting our goals. Now, this kind of looks at what we want to do for 18, and you see, we started off sort of in the hole here. 8.2 million variance negative, so we're $8 million behind in terms of what we wanted to achieve. Why? Harvey. Yeah, Harvey. What has Harvey done? It's not so much a direct expense, it's that patients aren't coming to see us. That's very understandable and explainable, right? Because they're preoccupied doing other things. They have things that are a higher priority to them. We've seen this sort of phenomenon before, reaction to things happening around us. Typically, we see a rebound. But as we think about where we are now in our fiscal year, what's ahead of us in the next couple of months? Holidays, yeah. What happens with holidays? Fewer working days. People get a little distracted. They don't tend to come to see their physician providers. We still have expenditures. We still have to pay our people and do all those things. So as we think about this, I just want you to watch what happens with these financial results. The Harvey impact is going to linger, probably through the holidays. It may well likely be after the first of the new calendar year before we have a chance to recover financially. So as leaders and managers, we just need to be aware of that. Think about where we are with our expenditures, adjust again, juggle a little bit. We should be okay over the course of time, but we're clearly seeing an impact from Harvey, okay? The other thing I wanted to point out here is that we have a forecast that goes out several years. Every year we turn this into the UT system so they can do financial planning at the system level. And what I want to show you here again, academic enterprise, hospital and clinics, institutional support, and auxiliary. Bottom line, again, in that $0 to $10 million range, again, that 1 to 2% range. Look at the investments here. The investment in the academic enterprise grows. We count on the health system to grow revenues to help us continue to make those critical investments that allow us to accomplish our mission goals. And we want to basically hold our institutional support expenditures at the current level, or if we can, diminish them over the course of time. So even looking at the forecast, you can see our strategy, if you will, for investment in the institution, how we want to direct our funds so we accomplish our mission goals, and how we support the generation of revenue over the course of time so we can continue to be successful with our mission work and financially, okay? So, please take this into account. If you have an opportunity to talk to the folks that you work with about this, please do so. I think, just getting to kind of this level of presentation and understanding will help a lot of our folks understand where we are, what's happening, and not only what's happening over the course of this fiscal year, but kind of how we're thinking about the years ahead. Okay? So anyway, that's what I want to touch on today, and we'll move on now. Now, the other thing that I hear, even the folks in CMC, Ojo, what's going on with facilities? What are we renovating? What are we building? Where are we going? And when I come to the main campus, where am I going to park? Because you got so many things disrupted. So I at least wanted to give everybody an update on where we stand with these major facilities projects. Very excited that Research Building 17E will open up a little bit later this year, providing some additional support space, if you will, to support what we do with the research enterprise, also some new research space per se. And so we're very excited to have that open. And Dr. Jacobs, it's going to be after the first of the year? Okay, so we're on track to do that, and I'm very excited to have that coming aboard. Health Education Center just across the street here. You see that coming along. I'm very excited about that building. It's going to offer us some marvelous new opportunities with regard to our educational programs, not only to enhance simulation, provide these low-risk, high-touch opportunities for learning, but also the opportunity to more effectively bring our students together from the different schools and pursue interprofessional education. I'll talk more about that in just a little bit. I'm very excited that project is coming along. Plan to open that in the spring of 2019. And then all of you have seen the drapes over the front of the John Seeley Hospital as we continue to work on renovation of this one big wing. That's progressing nicely, coming along. We're going to see some significant enhancements to the features within that building, some growth in terms of support, particularly for the women's and children's program. So we're very excited that that's moving along, and we'll have that open sometime in 2020. Lake City expansion. This is something we've been working on for a while. As you all know, this part of Greater Houston is growing very rapidly. In fact, with some accounting systems, this is the second fastest growing city in the country, League City. And there's a huge patient demand. You know that if you're looking at the access times to get into our clinics. We keep adding providers. We keep getting more requests for appointments. And so we want to respond to that. We think a critical effort up there is to expand inpatient operations, particularly as we move along with our collaboration with MD Anderson. Working with them, we'll need more inpatient space. We see opportunities and needs to grow our musculoskeletal programs, our GI programs, oncology in collaboration with MD Anderson, heart, thoracic, and vascular, children's program, inpatient program there. And so a lot of opportunity, and one of our first levels of response will be to expand the inpatient beds that we have there. We'll actually take this, we have this expansion pretty well planned, business plan is pretty much done, finalized. We'll take this, we're going to look over it one more time, make sure that we've addressed all the issues that we had, and then present it to our regents in February. We believe they'll approve it, and we'll move forward after that with the idea of opening this next phase of expansion for that inpatient facility in 2020. All right, shifting gears a little bit. Another thing that I've heard in meeting with people is they kind of want to see what's happening over the course of the year. So do a better job of presenting how are we growing, where are we growing, show us the numbers, let us see, rather than just telling us we've had a certain percentage of growth. So we've tried to represent the growth of the health system some pretty simple numbers here. Descriptions of total discharges, outpatient encounters, ER visits, inpatient surgical cases, outpatient surgical cases, and transplants. And if you just look across from FY15 to what's planned for the current year, here's 17 actual, 16, you see the growth in the numbers. So a nice progression. And you've heard me say before, Ms. Saulenberger, leaders in our health system, members of the academic enterprise and clinical rows talk about the growth, why we're pursuing it, the fact that we're one of the few places in the country that's actually seeing this sort of growth. It's driven by the opportunity we have with growth of population, some enhancement in our programs. So we're very pleased about this. As we go forward, we're not trying to be in the position of having the highest market share in the greater Houston region. Some people have asked me that. You're getting too big. Can't manage what you have. The idea here is to support our academic program. If we talk to our clinical educators, their primary concern today is clinical placements for our students and trainees. Where essentially those are actually being limited in number. We're seeing fewer opportunities at other institutions to place our students and our residents and our fellows. And so as we go forward, we want our health system to be right-sized so we can support the enrollment in our training programs. So that's what this is really about. We also see an opportunity to grow clinical research here over the course of time. We think we have a marvelous opportunity that can do a number of really good things for us and our academic program. So the health system growth is really being designed to help support our mission work in the future. And clearly it generates revenue. You saw that earlier slide. So we want to get this just right. Not too big, not too fast. Be in the right place as a state institution to accomplish our mission work. All right, so in some of the accomplishments, we've talked about Best Care. This is just huge. In the fall, I travel around and speak to alumni groups around the state and around the country. They are so proud of this outcome. They want us to publish something in all the local papers. So I have to explain the arrangement with Vizient and those sorts of things. But they're all very proud of the work we're doing here, and they certainly want it to continue. Some have asked, you've seen us show, Ms. Saulenberger and folks in the health system, Dr. Sharma, show the graphic representation of each of the major areas of measurement, metrics, and where we stood in the past. Remember when there was a big 76 in the middle of the circle? Look what's there now. There was a lot of red before. Look what's there now. A lot of green. The darker green, the better. So as we go forward, we'll keep this in mind, that we want this to be green, and we would love over the course of time for that number in the middle to get smaller. Now, every time I mention that, Ms. Saulenberger threatens to strangle me, saying this is a tremendous accomplishment. We've done something no other institution has done here. Let's just hold it where it is. Well, that's great, and understand there's a challenge associated with that because everybody out there is getting better too. But at the same time, our folks are pretty darn competitive. And I think most of us would like to see that number go down. So we're certainly going to do what Ms. Saulenberger has advised and make sure that we stay as a 5-star institution. But also, if we have an opportunity, we're going to push a little bit to move up. All right, other forms of recognition for excellence in patient care. Congratulations and thanks to folks who are members of our nursing service, all the people who support them, for the renewal of our magnet recognition. This is just huge. You see on the slide, less than 10% of hospitals in the country, health systems in the country, achieve magnet recognition for the work of their nursing service. And so this is something for which we should be very proud, and we are. And so thank you, and we certainly want that to continue. How many of you saw yesterday that we moved to Leapfrog A? Yeah, how about applause for that? This is, to me, a bit like the Vizient work. Our folks really want to deliver great care. A number of them on an individual basis do that every day. If I get sick, I'm coming here because I know the people here and their capabilities and what they do in their approach. But we have to make sure that our systems support their desires, their work, and their intent. And that's where we really focused and continue to focus. Make sure that their desire and skills are working in a system that allows us to make things, situations, clinical, either inpatient situations or outpatient situations, as safe as they can be for our patients, generating the best possible outcomes, making sure that patients aren't harmed and that they're satisfied with their outcomes, and that we're doing our level best to understand their desires, what they want when they interact with us, and working with them to help them achieve those goals. And so that's what Leapfrog really signifies, that we're doing well on that front, and we want to continue to score an A as we go forward with Leapfrog. Some other great things, our stroke center was again designated by the Joint Commission as a primary stroke center. Very proud of that. And I think we're working now with Dr. Bardwaj and Dr. Patterson, others, to try to move forward and get the comprehensive stroke center designation. A lot of effort occurring on that front. Also, we achieved the Joint Commission Gold Seal of Approval for advanced certification in chronic obstructive pulmonary disease care. So again, just some additional recognition for the really great work that's occurring in our health system, supported by all the people in institutional support and the academic enterprise. Very proud of those forms of recognition. Okay, accounts for education. You know, one of the things that I'm really proud about is the fact that we've been able to grow our enrollments so much since 2008. Of course, when I mention that to the faculty, I see Dr. Richard back there, they kind of back up like, what are you telling me? We're not growing anymore, are we? We're already stressed and at the max. And Trish, you didn't really say that, I know, but I just happened to see you in the audience. But it is a concern. You know, we're essentially at capacity now. We all know, those in education here know, that we need more health professionals. And we certainly want to do as much as we can as a single institution to produce more health professionals. And you see from this slide, we have been growing the numbers. And if you look at the bottom, you see a significant number of new graduates last year, and of course in the preceding years, turning out new health professionals and new scientists to help us move forward in terms of improving health for people in Texas and around the world. That said, you know, we can't really grow a lot more right now. We're achieving this growth demonstrated in this slide through the addition of some online programs and some other things. Now, as we move forward, as we open the new health education building, we probably have an enhanced opportunity. We want to be very thoughtful about that, again, recognizing the need to grow, but also doing it well supported by faculty, resources that support the faculty, and making sure that the quality of our educational programs remain high as they are today. But again, just a graphic representation, numerical representation of what's actually happened over the last 4 or 5 years with regard to total enrollment and graduation rates. And you see here our growth has slowed down. It's about 7.5% to 8% since 2013, because essentially we're at capacity. Research numbers, good growth. There are members of our research community that don't think that we're growing research, and they're worried about our investment in research and where we stand and whether we're supporting it well enough. And you know, I always appreciate all forms of feedback. I do want everybody to know that we actually continue to grow research funding. What you see represented on this slide, the big number at the top, the almost 6%, is the growth in total research funding between 2016 to 2017. What you see at the bottom is the total investigator-funded research amount for FY17. And it actually has grown by $7 million from 16. So our researchers are being very competitive for the available research dollars. As we've discussed before, those dollars aren't as available as they used to be. And to enable our researchers to win awards for grant proposals, we have to do a better job of supporting them. I'll come back to that in just a little bit. But we're actually making significant accomplishments on the research front in terms of competing for the available dollars that are out there. What this slide demonstrates is our NIH funding actually dropped a bit from 16 to 17, but that was offset by an almost doubling of federal funding coming from other sources. So Department of Defense, Defense Health Agency, other federal sources like those that have enabled us to actually grow the total amount of federally funded research between 16 and 17. For 16, we were ranked 51st out of 139 institutions in the country. Those rankings that describe our result in 17 won't be out until a little bit later in the fall. But again, for an institution our size, we're doing very well. We are concerned about this. We want to continue to invest, improve the infrastructure that supports research with the idea that over the course of time, we can become even more competitive for the available research funds that are out there. Just thanks to some of our faculty leaders. Dr. Freeman has agreed to be the interim dean for the School of Health Professions. We greatly appreciate that. We're organizing the search now, Dr. Jacobs, to choose a new dean. But Dr. Freeman's agreed to step into that role for now and serve as the interim to make sure that we continue to support our programs in that school and keep things moving forward. Dr. Marshall has agreed in his copious free time to also serve as the dean for the School of Nursing. Dr. Jacobs tells me as of a little bit ago that he's just about ready to make an offer. We've seen 3 really highly qualified finalists for the dean position in the School of Nursing. Very excited about that. So we should be, hopefully we'll know soon about that new dean for the School of Nursing. But in the meantime, thank Dr. Marshall for his willingness to serve in that role for us. Dr. Bardwaj has been named Associate Provost for Faculty Affairs and Professional Development. He's been doing this for a while for the School of Medicine and really helped move our academies along, focused through the School of Medicine, but the academies represent all the schools. We also want to do a better job as we go forward with faculty development. You know, we have young faculty that are hired or who we have grown here. They come in, they need mentorship, they need described pathways so they can develop their academic careers. And we want to do a better job in continuing to encourage them, describe the opportunities and options that they have, and helping pursue those that they choose. So Dr. Bardwaj's role is to look across all the schools, the academic enterprise now, and help support that growth and our efforts to our growth in faculty development opportunities. Finally, Dr. Torres is Assistant Dean of Professional Development and Diversity. Now, I have a story. Dr. Torres, are you here, Alfredo? I see him in the field house regularly. So Alfredo, a couple of years ago, and Dr. Jacobs, you can make sure I get this right. So he and I were talking, and he was kind of shaking his finger at me. Not really, but sort of, saying, you know, we're not doing a very good job here with faculty diversity. You know, you look at our classes, we're very diverse. You look at our workforce, we're very diverse. But you look at our faculty, we're kind of lagging. We need to do a better job with faculty diversity. What are you doing about it? I said, well, Alfredo, thank you for volunteering. So a big part of the effort is building the networks that enable us to be in touch with potential faculty members from all over the country who have different backgrounds and different sorts of educational experiences and opportunities that they can bring to our institution. And so Alfredo actually volunteered, with a little bit of nudging, to get engaged in the effort. So I really appreciate his willingness to do this. Did I get that close to right? A little bit of a story there. But anyway, thank you, Dr. Torres, for your willingness to help us on this front. And thanks to these leaders for stepping in to do important roles for us. Just to thank you again to everybody for the Hurricane Harvey response. You see a significant list of accomplishments listed here on the slide. And of course, this comes nowhere close to describing the marvelous work of our people during Hurricane Harvey. We have plans, we have systems. Mike Mastrangelo does an amazing job in terms of keeping us well prepared, thinking about what can happen with the storm or other major emergency, making sure that we execute our plans, we get resources in the right place at the right time. But no matter how well we plan, things happen that we don't anticipate. We learn from every experience. And during these times of emergency, unfailingly, our people step into the breach and just do amazing things. And that certainly was the case with Harvey, from people swimming in to work, to staying extra time, to looking out for fellow employees, to doing incredible things in support of patient needs when patients were negatively impacted by the storm. So I just want to say thank you again for incredible work. Certainly make us proud, and the Regents and the UT system folks definitely notice, so they extend their thanks also. Now, one of the things that we have been concerned about is how do we help our folks who were impacted by the storm? And so you may remember that we put together a couple of funds. We put one together for our students. We did this after Ike also. And we have, I think Ms. Clardy told me yesterday, we have $14,600 now that's being distributed among 142 students who have asked for some assistance. And so hopefully that will help to offset the loss of personal possessions, academic supplies, those sorts of things. The UTMB Employee Fund is a partnership that we did with the United Way, so that they essentially will take the funds for us and distribute them for us, which gets us around some of the state prohibitions on what we can do, or some of the tax prohibitions we would have if we directly offered financial support for employees. We have about $172,000 that's being distributed in the next few days to about 557 employees who applied for assistance. Finally, the Texas Hospital Association has a Hurricane Harvey Fund. Of course, it will be extended across the state to all areas impacted by the storm. But we've had a little over 1,000 applications for support from that fund, and we're told by the THA that they will be distributing those funds around Thanksgiving. So certainly we want to do more, continue to be supportive of our folks, but these are two significant, really three significant efforts that essentially supported by people at UTMB to help out our colleagues in need. Now, as an administration, some of the things that we've tried to do, we do a team award every year when we can, and this year we did a team award for our classified employees. What you may not know is we push the amount up. Every year we try to hold some money aside to recognize our employees, and at the end of the year, if we're doing well and we can afford it, we pay that out as a team award. This year we actually pushed beyond the amount we put aside because we thought people could use the extra money. And some people said, well, how come you didn't just identify the people who were impacted by the storm? Everybody was impacted by the storm. Everybody worked hard. People have stepped in before the storm, during the storm, after the storm, sometimes when colleagues couldn't come to work to help us continue our work here. What state law allows is to pay cash, if you will. We did some also leave for other employees like our A&P and our classified exempt employees where a cash payment doesn't work with state law. We can't do the compensation with leave for classified employees. And so some people have asked, well, what's the difference? How come classified non-exempt employees didn't get the leave time? Well, because we can't do that. That's against state law. So what we've tried to do to recognize the entire institutional effort during and after Harvey is use team award for classified non-exempt employees and add to the amount of cash that we paid. And for those folks who aren't classified non-exempt, use the compensatory leave time. So that's what we've tried to do in addition to these things to recognize the incredible institutional response associated with Hurricane Harvey. Okay, shifting gears, I want to talk a little bit about priorities for this fiscal year, and these will likely extend into the future. People, obviously, a priority, continuing best care, continuing to grow, again, in support of our mission work Analytics, predictive analytics, big data, we're all talking about that. So what are we planning to do with new tools? Support for research, I mentioned that a little bit earlier in health education. So let me just kind of give you the big picture of where we want to go with each of these priorities. Okay, so for people, UTMB is a good place to work. Now, some people might disagree with that statement, but we are regularly recognized as one of the best places to work in the greater Houston region or in all of Texas. In fact, if you look at the bottom line on this slide, there's going to be another announcement coming up this month? Mid-November, okay. So this month, about being recognized by some other group as being a best place to work. But clearly, we want to do a better job of supporting our people. We're always looking at compensation, since this is a principal form of reward that we have. We're bound by state law. We have certain things we can do and certain things we can't. So, but within what the law allows, look at how we structure compensation, how we optimize the benefits programs that are available to us, how frequently we look at the market and what's happening, the different approaches to the market. So, for example, for our classified staff and many of our administrative professionals, the market is essentially local and regional. We're competing with places like us, around us, and we peg the market research looking locally and regionally. For our faculty, it's national, and in some cases, international. And those markets move differently and in different ways. So we need to continually look at how we assess the markets, how we compare where our people are, what we're doing for them, to what's happening around us, the limitations and opportunities that the state regulations and laws around compensation, what they allow, and then try to get it right as we go forward. And so we'll continue to look at compensation systems, structure, how we go to the market, what those marketplaces look like, what we do in response, and try to be more transparent about how we communicate that. One of the things you may have noticed is that we now, if you go out there under the site where you go and look at your paycheck, there's a total rewards statement. Some of our folks have said, well, what's the value of my benefits? How do I calculate those? And how would I compare what you can do for me here to, say, for example, what would happen in another place that's offering me a job? Well, you can go out and look. You can encourage your people to go out and look. Take a look at that site, and there's a monetary value that's given to the compensation and benefits, and that kind of comes to that total rewards number at the bottom. So that's a comparator that's available for our folks to use. And so please encourage them to take a look at that. And if they want to look at what another place is doing or offering, that's a good place to start. What does UTMB do? What's the total monetary value of that? And how does that compare to what's happening at other places? Certainly want to continue to work on development programs. We continue to hear we want, as a group of employees, more opportunities to develop our skills, to be able to seek additional responsibilities, different job at UTMB over the course of time, being able to do more. So we continue to think about that, how we go at that, how we offer additional development opportunities and additional opportunities for people to move on, move higher at UTMB. So again, try to make UTMB a better place to work. We're excited we're already recognized as a great place to work, but we want to be even better as we go forward. And keep those cards and letters coming in. Probably more often than not, the ones that get to me are complaints, but that's okay. If there's a real concern, send it so we can take a look at it. We can try to understand the basis for it. And, all feedback is useful to us. So if you have a concern, please send it to us, and we'll try to send out a response. Even if it's anonymous, at least let people know we've received this concern, and here's how we're thinking about it, processing it, and what we hope to do to improve the situation. All right, best care. We spent some time talking about this earlier. We certainly want to cement those gains, at least stay at that number 9 level. But we also want to move on and kind of think about, what about this thing of being a high-value practicing organization? Being at best practice or being involved in developing best practices in terms of the ways that we use diagnostic imaging, we use laboratory testing, We hospitalize patients. We run their inpatient stays. We manage their outpatient needs. So also turning our attention to a little bit broader scope of issues over the course of time, trying to drive that set of value outcomes as we go forward with our patients. One of the things we're also working on is the high utilizers of care. Some of you may be familiar with some of the assessments of what's happening across the United States healthcare system, where roughly 80 to 85% of expenditures are attributed to 10 to 15% of patients. So they're high utilizers. There are good reasons for that. These are sick folks. Oftentimes they have social issues that are standing in the way of good health. So how does an individual institution like UTMB respond to those sorts of challenges with each patient? We want to look at those high utilizers who have typically required high-cost care and see if we can partner more effectively with them to reduce that cost and do a better job of keeping them healthy. Growth, I mentioned this earlier, just kind of thinking about how we're growing, how we make good decisions about where we grow, how we support our mission work, what's the best way to do that, how we invest as we go forward. We always have a lot of opportunities, how we choose the best ones, and what metrics do we assign to assess outcomes. Also, what metrics can we use to decide whether or not we need to make a change in course. So that's all part of this growth priority as we go forward. Analytics, I mentioned this earlier, trying to use information more effectively. We have some things coming. Dustin Thomas tells me that there's going to be a link available in January on the UTMB homepage, which will provide expanded content, tell us more about what's happening across the enterprise, particularly the health system. We'll have more automated reporting of key statistics so we understand more in real time what's happening, and hopefully this information will be more useful in helping us make quicker decisions about what we need to do to improve outcomes for ourselves and for our patients. So very excited about moving our effort with predictive analytics, the use of big data, forward. Research support, again, talked about this earlier, some of the things we want to do, grow the clinical trials effort. One of the things we hear regularly from our research investigators, our faculty members, too much administrative burden. That's true. Much of that is placed on us by the entities that provide the funding. The federal sources, other sources. Our faculty have to do a lot of tracking and reporting. If they're going to apply for a grant, they have to do a lot of paperwork. And so what can we do? We can't make that go away, much of it, but we can do a better job of supporting the completion of that administrative work that's necessary to pursue grant funding. So we certainly want to try to do that. Continue to think about how we invest in new equipment, new facilities to keep us on the cutting edge of research, and also think about how we use the available space that we have to support research more effectively. Health education, I mentioned the new education building, very excited about that. The opportunities we have to enhance our educational programs, do a better job of supporting our education faculty, develop additional simulation for a deployment in that new building, and move on to the next level of interprofessional education, bringing our students together from across all the schools to train together, if you will, in different clinical situations so they understand what each other does, and hopefully when they move into practice, they can do a better job of providing patient care. Now, the bullet at the bottom, the Quality Enhancement Program, we've been focused on interprofessional education for a while, but we'd like to move it to the next level. I did ask Dr. Mouton, is that IPE 2 or IPE squared? He tells me it's IPE 2. So moving to the next level with interprofessional education, and he promised he can answer any question that you have about that. So he's here at the ready in the middle of the room, so please take advantage of the opportunity. So bottom line, key takeaways, very good financial performance in 16 and 17. We'd like for this sort of performance to continue. We've hit a little bump in the road related to Hurricane Harvey for 18, but we think we can overcome that. Again, just managing effectively as we go forward. A lot of construction work across our campuses, all good things in support of our mission work. Very excited about bringing those new buildings or those renovations online over the course of the next couple of years. Thanks again for the marvelous response to Hurricane Harvey. Our folks always step up in the face of any challenge or emergency. We're most appreciative. A lot of ongoing accomplishments all across the institution, every area of mission work and institutional support. Good work by our people, everybody working hard. Congratulations on the recognition that goes along with that, particularly for Best Care, Magnet, Leapfrog, the new designations by the Joint Commission. Finally, just touching on our priorities, these major areas of focus for us. Certainly not trying to describe everything that we want to do over the course of this year and the ones that follow, but talking about what are our priorities in terms of people, best care, growth, the use of big data, predictive analytics, what we want to do to enhance research, support for research here, and move along with our educational mission work. So those are the things I want to present to you today. Thank you very much for your attention. What questions do you have for me?
For you, but I want to tell you and our leadership, thank you for being such great bosses. I mean, despite the you always try to show your gratitude to us, your employees or UTMB employees, and I think that's priceless. In spite of the circumstances, everybody's getting a team award. Us AMP are being rewarded with compensatory time, and to me, that's priceless. So thank you and your team.
Yeah, well, again, I think our leaders here are amazing. I'm just so blessed to get to work with the leaders that we have all across the institution. I've never been in a place where there's so much concern about taking care of our people. And it's really great. That's what we need to do. If we don't take good care of our people, we're not going to accomplish anything else. Now, that said, we need to continue to look at how we do that. Every day there's a concern about something that happens with at least one of our people, typically more. And so we need to continue to look at our systems, what happens in these extraordinary circumstances, how the systems respond. Again, try to do a better job over the course of time taking care of our people. Our people just do incredible work. So thank you all. Other questions for me? Dilly?
Dr. Callender, we did have a question submitted to the Employee Advisory Council. I have worked at UTMB for over 25 years. During all of that time, making an appointment to see my doctor or to visit a specialist has generally involved a wait of weeks, if not months. I realize that in urgent situations, I cannot see someone fairly quickly, but it is not the same. I usually have no history or relationship with that person. During that same time frame, UTMB has announced initiative after initiative aimed at cutting those wait times. They never seem to have any effect. As UTMB extends its reach and engages more and more new patients, I'd like to know, are extended appointment wait times still a concern, and when can we expect to see an improvement?
Yeah, thank you. We're very concerned about that. I think it's one of the primary concerns of the folks who oversee the health system, both the physicians as well as the administrative leaders. Dr. McCollum and Ms. O'Connell work on this every day with people in our clinics. Of course, as I mentioned earlier, you look at those outpatient numbers, we anticipate 1.1 million outpatient visits this year. The demand is growing. So we can't be static. We can't just be satisfied to improve. We have to continue to work to improve access to the physicians and providers in our clinic. Dr. McCollum did tell me that I think we've seen in 60% of clinics, we've seen a significant improvement in access times. So actually we are making progress. May not seem that way. So it's better in some clinics than in others. That means, 40% we haven't really made any significant progress. But what the leadership is trying to do, again, physician administrative leadership, is look at each clinic, the demand for services, do a better job of characterizing that, stratifying it, if you will, understanding what are the most urgent needs, what are those that can not quite so urgent, how do we manage those relative to the available provider time that we have. We've given each clinic a target now based on what's happening in the market, what we think is appropriate for each of our clinics in terms of access times for new appointments and follow-up appointments. And many of our clinics, if they're not there, they're moving close. Now, in a few clinics, I know we've seen a deterioration in access times, and that's typically been in a situation where we've had an unanticipated loss of a faculty member or faculty members. But in every case that I'm aware of, those faculty replacements are already here or on the way. So hopefully we're going to get back to where we need to be. So from my perspective, I understand the frustration. It is a priority, and we're actually making progress. This will continue to be a priority for us as we go forward. I just want to also remind everybody, we do have the 2CARE phone line, 772-CARE, which is what? 2273. 2273. Okay, thank you. I have to think about that keypad. And it is specifically for our employees to call in and use. We also have Sylvia Campbell. Sylvia, you're here. Raise your hand. So Sylvia is also available to help with situations where people need a clinic appointment and they're frustrated in some way, can't get it in a timely manner. And so please take advantage of the 2CARE line and Sylvia's efforts, and we'll see if we can't solve many of the problems that currently exist. But bottom line is, yes, we are getting better, and this continues to be a focus for it. Probably will be as the demand grows for our services. Thank you. Any other questions, Tilly? Jill?
Good afternoon. Another question that was submitted to the EAC was, will nurses be getting raises this year? I just asked.
Somebody remind me, I think, aren't we right now doing the market assessment? So I mentioned this earlier, our compensation system. So we go out and we look at least once a year. Sometimes with certain fields, we look more than once a year, depending on what is happening in the markets around us. My understanding is the nursing market has moved. It continues to move fairly aggressively. So I suspect that we'll need to respond. I just don't have any data right now. So I think the best answer to the question is probably based on what we believe about what's happening in the market. But we'll have that market assessment soon, and that information should be available pretty quickly. Okay? Thank you. Other things? All right. Any of our other executives want to make anything I missed or got wrong? Dr. Jacobs? No? Ms. Hollenberger? Ms. Adro? Okay. All right. Thank you all very much.
UTMB Health. Working together to work wonders.